Chest pain. A simple phrase, but such a headache for emergency physicians. But why is that? Simply put, there are a lot of organs in your chest you need to keep you alive, and if you decided to come to the emergency department, we have to assume it's an emergency, and that one of these organs is getting ready to fail and kill you. What organs, you ask? Well, they're your lungs, which do all kinds of great things for you, like providing oxygen to your body, and getting rid of waste products. Any number of lung diseases, like asthma, COPD, pneumonia, pneumothorax, and the ever-elusive PE can cause your chest to hurt. Moreover, each of these diseases have a range from mild to life-threatening. Also sitting in your chest is a large artery called the aorta. It carries all the blood from your heart to the rest of your body. It's under somewhat high pressures for an internal organ, and pain in your chest could mean that this tube is tearing or leaking, a ticking time bomb, so to speak, an extremely rare but very deadly condition. Right next to your aorta sits the esophagus, a muscular tube that moves food from your mouth to your stomach. Pain in the chest could mean that you ate too many spicy Cheetos, or that you've been vomiting so much that there is now a hole in your esophagus leaking toxic fluid and food into tissues in your chest, which is now brewing a life-threatening infection. Let us not forget about the heart. It circulates blood through your body, and most importantly to your brain. Always working, always moving, even when you sleep. Heart disease accounts for 25% of all deaths in the United States, and is the leading cause of death based on 2010 census data collected by the Centers for Disease Control. This is statistically more significant than any of the aforementioned diseases combined. So, by an overwhelming margin, if you come to the emergency department with pain in the chest, we are going to think about your heart. As should everyone. Changing to a healthy diet, exercising regularly, and quitting tobacco products can help us change this number far more than treating the disease after it is discovered. There's a virtual hodgepodge of medical conditions that can mimic any of these serious diseases, but are far from something we care about in the emergency department. Perhaps even more concerning is that these deadly diseases can also mimic non-emergent disease, or even present as some arbitrary vague complaint like weakness or nausea. The reason is, the body isn't very smart when it comes to organ or visceral discomfort. The sensory nerves that go to your organs are not as organized or smart as the nerves on your skin. They tag along nerve fibers from your shoulders, arms, hands, back, and abdomen. So when your heart may be sending a signal of red alert, it may be tied to the same path your shoulder uses for pain. Your brain then interprets this as shoulder pain, and you may think nothing of it, and end up dying of a heart attack. The pain may even move between places, muddying the picture even more. If your brain can't even figure out where the pain is coming from, how are we supposed to? Well, simply put, we don't. We use data like age, your presenting story, and objective findings to help lead us to the most likely reason for your chest pain. If you are young, healthy, and have pain that is worse with movement after doing a bunch of push-ups, don't be afraid if we send you home. The overwhelming probability is that you do not have something serious, and exposing you to radiation or costly tests is not in your benefit. But if you have poorly controlled diabetes, a sedentary lifestyle, and are over the age of 50, don't be surprised if you're stuck in the ER for a few hours or even admitted. Your chances are higher that something serious might be going on. So please, if you come to the hospital with chest pain, be patient, be understanding, and don't be surprised if you have to stay a while. There are a lot of things in there we have to worry about. Provide a clear story and bring up your concerns. If you're worried about your heart, then say it. Your story may have been leading us somewhere else. We are doing our best with the tools we have to keep you safe.